Jeremy, Gabriel, thank you very much. Dear colleagues, I wish to report on the phase 3 trials on Pegcetacoplan, and I think it's a historical stage in the retina world that we for the first time have positive phase 3 pivotal trials showing a treatment effect. And for you and us in the clinics and the hospitals, we see patients each and every day asking for treatment for geographic atrophy, and now we have something to offer, which is a huge step forward. I will be briefly reporting on the two pivotal trials, Derby and OAKS, and also on the GALE, which we heard from the previous speaker. And importantly, after 24 months, all of the patients in the trial before, including the sham arm, had the opportunity to be rolled over in an active treatment arm. And looking into the future of study designs in clinical trials in geographic atrophy, as we had with anti-VEGF therapy in the early days where we compared against sham treatment, now the future studies will be comparing against active treatment, which of course means a lot to the patient whom we recruit in these trials. And a total of 83% decided to be rolled over to be continued treatment, or the sham treatment patients decided to have the active treatment in the so-called GALE extension study. Now, just one number I wish to pick out here due to time constraints. This is a total of 792 patients who are being treated and followed in GALE, so this will represent a rich database for future analysis, which will inform us on also how we select patients in the future. Now, as there was no longer a sham treatment arm, these numbers for the trajectory for the growth rates had to be estimated and calculated, but fortunately the disease behaves in a very linear fashion in that expansion rates of atrophy behave linearly, and so it is possible to make a guess how these eyes would behave if they have no treatment and would have been remained on the sham arm. And obviously there's an incremental effect if we do these 6 months slices over the observation period. There's a treatment effect of up to 39% in growth rate reduction over this period of time of 30 months here. And interestingly, now looking at the growth rates of sham-treated patients, over the first 6 months, we already see a treatment effect by 14% growth rate reduction, and this, interestingly, basically corresponds to the first 6 months, which also had a 14% reduction in growth rate. Now, we were already informed by the 24 months data that patient populations, subpopulations may behave differently, and interestingly, and this is not yet explained, there's a knowledge gap that those patients at baseline with extrafoveal lesion grow faster but also respond better to treatment as opposed to patients who have foveal lesions to start with. Now, an interesting question to ask, as geographic atrophy behaves extremely symmetrically between the two eyes, so growth rates are usually almost identical between both eyes, so the fellow eye could serve as a potential internal control, though when looking at the growth rates of the treated eye, of the study eyes, as opposed to the sham treatment eye, there was a slower growth rate in the treated eye as opposed to the eyes, to the fellow eyes. Now, briefly, safety is of course key with a new treatment modality in this space, and over 20 and up to 40% had treatment emergent adverse events such as vitreous floaters and intraocular pressures. We'll touch upon others in a second, and you may have read in the post-marketing analysis of patients in the US where the agent is already approved by FDA and is being used, and interestingly, more than 100,000 vials of Pegcetacoplan have been distributed in the real world, and over 24,000 in the clinical trial settings. And this observed event of retinal vasculitis, be it occlusive or non-occlusive, occurred at a rate of roughly 0.01%. And as of today, there have been 10 reports in this high number of treated patients, and some of them had remained visual impairment from this event. So we have to watch out if, in any case, if there's a new treatment, and there seems to be a hint that the filtration needle may play a role, but the causal relationship has not yet been clearly established. So to conclude, the vast majority of patients who completed 24 months OAKS and Derby crossed over into the GALE extension study, and we saw an incremental increase in growth reduction rate also after the study period of 24 months, and this is up to 40 5% in the monthly treatment arm and up to 33% in the every other treated months. And we will see how we select our patients if we put them on monthly or bi-monthly treatment. And we understand in the US, roughly 80% of our colleagues use the agent every 2 months instead of every month, also considering the risk-benefit ratio. Safety in GALE has been similar to that observed in OAKS and DERBY studies. Within all these trials, there was not a single case, no event of non-occlusive or occlusive retinitis or vasculitis. And with this, I'm happy to take questions. Thank you.
I think we'll have to move on because there are less of time. We have to continue. Sorry.
Thanks. The next talk will be by Dr. David Almeida on the